So your little one has a fever. Suddenly, you feel like your world has shifted, right? You're not alone. I see this all the time in the ER. Parents panicking, Googling every symptom, wondering what next to do or if this is an emergency. Hi friends, I'm Dr. Nkirika, a pediatrics ER doctor and mom of 3. At the end of this video, I promise you will know why your child may have a fever, what counts as a fever for babies, toddlers, and older kids, when it's actually fine to watch at home, and when to call your regular doctor or head to the ER. Grab a cup of water or tea, take a deep breath, and let's talk through this together. Now let's start with the basics. A fever is the temperature 100.4 Fahrenheit or 38 degrees centigrade measured rectally. For toddlers and older kids, we normally use the armpits or the forehead because it's less invasive and so much easier for everyone to tolerate. Here's the thing. A fever is not the illness itself. It's your child's body responding and fighting off something. Think of it as your tiny immune system trying to suit up for a battle. So while we always ask you what the number on the thermometer is and what their temperature is, I always tell families, don't fixate on the number. Watch your child's behavior. Are they playing? Are they active or alert? It's always much more important to us compared to the number. But as a mom myself, I get it, and we will still worry about the number. Now, why do kids get fevers, or why does your child have a fever currently? Most fevers in kids are going to be caused by viruses like cold, flu, RSV. Some other times it could be due to a bacteria like ear infection, strep throat, pneumonia, even a urinary tract infection. And in some rare cases, it may be due to things like cat-scratch disease or severe cases like cancer, which we're not going to discuss today. Babies may also get fevers after vaccination, or their temperatures may also be too high if they are completely overdressed and bundled up, especially in the warm season. So the number alone is not dangerous. It's a combination of how old your child is, what the temperature is, but also how your child is behaving, acting, and eating at the time. In a lot of babies and kids, it might be difficult to know what the cause of the fever is from the get-go, but keeping a log of the symptoms, the fever and the runny nose, fever and the sore throat, maybe a little diarrhea and vomiting, or maybe difficulty eating can help your doctor actually decide what the cause of the fever is and what the testing might require. Now, before we talk about what to do with a fever at home and caring for your child, let's talk about a really important part, which is the red flags. These are signs that mean you should pick up your phone immediately and call your child's doctor or head to the nearest hospital or even emergency department. For babies younger than 2 months old, any fever is a concern that needs to be evaluated. These babies still have developing immune system, so they always need to be checked out. So you want to call your regular pediatrician or take them to the nearest emergency department or even hospital. For toddlers and older kids, this is a little different. While I struggle with giving a number that I would be concerned about, I would want a child who has a fever at temperature 105, 106, and 7 and higher should actually be evaluated. Some other red flag that I would recommend a child getting seen immediately is trouble breathing or fast breathing, dark lips, blue lips, change of color. If your child is vomiting, not able to tolerate anything by mouth, and there's a likelihood of them getting dehydrated, excessive sleepiness and difficult to wake up, fevers with difficulty or refusal to move their neck is a concern for meningitis, confusion, or looking like something is off or your child is not responding appropriately, or your child has had fevers that has been lasting longer than 5 days. Now, regardless of all the red flags that I listed, even if your child looks okay, trust your instincts. You know them better than anyone else. If you think something is off, it probably is, so please get them evaluated. Now let's talk about some home care tips. For those fevers that are not emergencies, here are some things you can do at home to make your child feel good even when they have a fever. For babies who are 2 months plus and toddlers, frequent feeding, whether breastfeeding or formula feeding, light clothing that are room temperature and comfy. You don't want to bundle them up, which can cause overheating. Keep them close to you, keep an eye on them, on their behavior and their feeding. Non-medication options like tepid sponging them with warm water can actually help the heat evaporate and make them feel better. If your child has a fever and they're uncomfortable, medications like acetaminophen is helpful if they're younger than 6 months old. And if they're older than 6 months old, you can also add ibuprofen if your regular doctor recommends that. Medication for kids are always best effective and mostly dosed by weight, so make sure you check with your regular doctor for their most recent weight and the right dose that will help their fever. And then for older kids, plenty of fluids, water, soup, popsicles, ice cream, rest, light clothing, being in a cool room, medications like acetaminophen and ibuprofen if needed. If they're uncomfortable, you want to keep them home to rest and also prevent the germs from spreading. Most fevers in kids and all the other symptoms improve within a couple of days. I always tell parents that your calm presence and your hugs are most of the time the best medicine for them. While you're watching and managing your child at home based on some of their symptoms, your doctor might actually recommend some testing. If your child has a runny nose, especially during the flu season, has sore throat, belly pain, vomiting, watery stools that maybe have blood, they might require some testing while you're doing all the other home care you were doing. Now for some truth talk. Here are some common mistakes that parents make when their kids have a fever. Giving the kids adult cold and flu medication they already have at home. Adult medication have a lot of contents that are not fine with kids and can cause some side effects. Overdressing and bundling your kid up or even underdressing them when they have a fever. Panicking and treating every fever. Fever is your child's body responding to an infection. A lot of times their bodies can handle it without medication. You don't want to treat the number, you can treat your child with medication if they are uncomfortable. Assuming that every kid in the house with a fever has the same symptom and treating with another kid's medication. While this is an easy thing to do, it may be masking some symptom or even leading to other consequences. And finally, ignoring the red flags that I listed before. Understanding these basics, knowing what's normal, what's concerning, and what red flags are can really take the stress out of fevers for us. So to wrap up, fever is a natural defense mechanism. Most fevers in healthy kids are due to viruses and can be safely monitored and managed at home. If your child is younger than 2 months old, every fever is a concern and they need to be evaluated. Keep an eye on the red flags: breathing troubles, blue or darker lips, extreme sleepiness, difficulty moving their neck or pain with moving their neck. And for management at home, keep your child hydrated, comfortable, observed, and medicated if they're uncomfortable with the fevers. If you found this video helpful, leave me a comment and don't forget to subscribe. And share this with a parent who's worried about a fever. Remember, you know your child best. With a little guidance, you can handle fever without panic. You got this.